how far in advance should someone start preparing for a trip from a health perspective?
Okay, so I think this is an excellent question, and it's one I think people don't give a lot of thought to. You often book your holiday and wait until the week before to get your vaccines. But actually, what we know is that it takes between 2 and 6 weeks to make antibodies to the vaccine. So people sometimes go to a pharmacist, get their jabs the day before. They're not actually protected until they come back. And
If you're getting a vaccination the day before a 1-week trip, you'll only have immunity.
have immunity on return.
Yeah, the day you
arrive
back,
back.
the earliest.
There's also things like, for some places that you go, you may need a certificate to get into the country for like a yellow fever vaccine. And that certificate isn't valid until you've had the vaccine 10 days before. So that's another mistake that people make, is they leave it too late and then they don't have a valid certificate and they may not be let into the country. And then there's other things like malaria tablets, and some of those you can take last minute, but some of them you need to take for some weeks before to get enough of the medication into the blood to protect you against malaria.
So it feels like ideally we'd love about eight weeks notice, something like that. But it's worth saying in every single clinic we see someone. Most clinics, we see someone who is leaving the next day.
The next day.
They're often living with something quite complicated.
Yeah.
They're going to quite a remote place. And I would say we can always do things to reduce their risk of travel.
Exactly. And the other thing that I'd like to add to this, that, about 80% of things that we can talk about that reduce the risk are not prevented by vaccines. So there's a lot we can do at the last minute by giving information. And some people don't have the choice to come early. There may be a family emergency or a bereavement overseas and they need to get out there quickly. So don't think, oh, it's too late, it's not worth coming for advice.
That's right, isn't it? And so much of each clinic we spend talking about, particularly the live vaccines like yellow fever vaccine, or we talk about anti-malarials, these sort of quite well-known risks of travel that there's a lot of risk management around. But in a way, it's the advice that we give around all the other things you do when you're traveling that's really important. And that can be done as you get on the plane.
And I think the other thing that's really worth bringing home is some people who've had something very complicated happen, like they've needed a bone marrow transplant or something else. They might start thinking about travel a year or so before they really go, and they don't know where they want to go. It's still worth those people coming and seeking advice early to say what might be possible and where are those risks. So don't feel like you're asking too early. You don't need definite plans. You can just get some sort of ideas in place as to what is safer or less safe.
And I think there've been quite a lot of patients I can think of specifically where they've come with one itinerary, and we've said, look, this itinerary, I guess I'm thinking about people often maybe traveling through areas with malaria with very young children.
Yeah.
And we've said, look, you can do a similar trip. You just need to change the destinations a bit. You can begin and end in the same place, but don't go through that country.
Yeah.
And then actually you can have the same adventure, but you need to modify the itinerary. And we do itinerary modification quite a bit, don't we?